Okay, today we're going to be doing our tracheostomy skill, and this involves collecting a specimen, a sputum specimen from the trach. We're going to go back and suction again, and then we're going to do trach care. So I just want to show you what the trach tube looks like when it's in the patient. When the doctor inserts the trach, this has an obturator in it. So you can see it makes a nice rounded edge on the bottom of this. And what they're going to do is they go right in the neck and they put this in there, and then what you do is you take a syringe and you blow up this balloon. So if you see the balloon that's right here on the end of the trach, that inflates and that helps hold it in place in the trachea, and it keeps the secretions from your throat going down into your lungs. So you can deflate the balloon, you can inflate the balloon, and then once he gets it in, the obturator comes out and the disposable inner cannula goes in there. The patient has his trach, he's had it for a few days now, and he is on a trach collar. Our flow meter is set at 6 liters. I'm coming in the room, I'm going to wash my hands. And in this case, he will not be able to speak, so I'm just identifying him by his name band. You can get him to nod if you need to. And I'm explaining to him what we're going to do. So the doctor has ordered a sputum specimen. So this is my specimen trap. I need to go down and suction you. I'm going to get a specimen, and we are going to hyperoxygenate him. Now, some patients have different requirements for oxygen when you suction. Some of them you can just turn it up to 100% while they're on their trach collar. Have them take a few deep breaths and they'll be fine. Hopefully you're going to have an O2 sat monitor on them so you can monitor what their O2 sat is while you're doing this. In this situation, we're going to pretend that he does not tolerate that well, so I'm going to use what's called an ambu bag, and I'm going to be turning this up to 100% and giving him some extra breaths. It just gives him 100% oxygen before I suction him. So anytime that this is exposed, whenever you uncover your trach, you need to be protected in case he coughs. So what I'm going to do is I'm going to put on my mask, and I'm going to put on my non-sterile gloves. I'm going to get everything ready here. Yeah. Okay, so this is a suction machine. So unlike your NG skill where you wanted it on intermittent, for this you want it on regular. So I want it on continuous suction. I'm turning it to regular, and you only want it to go as high as about 150. So again, for our machine, looks like 150 is almost straight up. So again, you're covering the end of this with your thumb. There we go, I'm at about 150 there. So that's where we'll leave that. So our suction is ready. And then what I'm going to do is I'm going to change him to 100% on the ambu bag. So I'm going to turn the flow meter up to 100%, which is 12 to 15 liters. I'm going to take this trach collar off, and I'm going to put this on. Now sometimes this might be a little unrealistic because it's kind of heavy, so you might have somebody come in and do this for you, or might prop a pillow under it. But he's getting oxygen right now, he's just not getting the extra breaths until I give him a couple big pushes of this. So now everything is ready. I'm going to take my non-sterile gloves off, and I'm going to get this ready. So this is my suction specimen trap. So what you're going to do is you're going to connect this. This little Christmas tree adapter is going to be connected to the end of your suction. And then what needs to be sterile is everything that goes in here. So for this case, I'm going to pretend that he's very cooperative, and he's just going to not move while I leave that right there. I need to put a chucks down here. This can be kind of messy. And then I'm going to open up my suction kit. So inside your suction kit, you can see these come, if you can zoom in here, these come with a little box on the outside of here. So what I want to be careful of doing is to only touch the outside of the box. So if I take this out, I'm going to open this up, and what I don't want to touch is what goes in here. This is what needs to be sterile. So if you open that up and pour your normal saline in there, And then just be careful that you're not crossing over anything that's opened up and is supposed to be sterile. So there's my saline. And then you can come to here, and you can see there's a pair of sterile gloves, and there's my suction catheter. So I'm going to put my sterile gloves on. And I'm going to get my suction catheter out of here. So I have 2 sterile hands still. And then what I like to do is I like to wrap this up in my dominant hand. So I'm right-handed. I'm going to wrap the tip of it up in my right hand. Everything is still sterile. Now I'm going to contaminate my left hand. So what I'm going to do is I'm going to pick this up. I'm connecting my suction catheter to it. And this is where the suction is going to be applied. Now everything from here to my left is considered dirty. Everything from this white suction port to my right is considered sterile, so I don't want to mix those up. So everything's sterile here. Now I'm going to give him a couple deep breaths. When he takes a deep breath in, I'm just giving him some extra oxygen. You don't want to go too fast. It's a lot different when they're on a ventilator, but this is what we're doing for this patient. So you've given him a couple deep breaths. You're going to remove the ambu bag. And then what I'm going to do is I'm going to be suctioning. Now you only want to suction, you only want to apply suction on the way out. This has to stay sterile. So I'm going down in here. You can see my thumb is off of this port. And you go down probably about 6 or 8 inches. They're going to start to cough. Then you're going to tap this and swirl the catheter to get all those secretions out. I'm going to roll it back up in my hand. It's full of his sputum, but it's sterile because it's his sputum. He's my priority right now. His O2 sat is dropping, so I'm going to put this back on. I'm going to give him a couple breaths. And then what I want to do is I want to stay sterile because I'm going to disconnect. I'm going to disconnect my sputum trap. And I'm going to set it up here. Because what I want to do is I want to stay sterile and I want to go down again. So I'm going to reconnect this just by touching that white suction port. And then if you picture that this is all full of sputum, I'm going to suck some saline through there. If you don't clear your line, you won't have suction to do another pass to suction him out. Rolling this up in my sterile glove again. A couple more breaths. Go down one more time because he had lots of secretion. So again, thumb is up until I go down and meet resistance, making sure my sterile glove isn't touching anything. Tap, tap, tap. You never want this to take longer than 10 to 15 seconds. A couple more breaths. And most patients do not tolerate it being suctioned more than 2 or 3 times. We're going to pretend I got very few secretions out that time. I'm going to clean it out again just so my tube is clean for the next person who uses it. This part of the tube. And then what you can do is you can go in the mouth. So I suctioned his trach. I'm going to go in the mouth. Typically a lot of secretions come up there. This doesn't have to be sterile anymore. Again, we're full of sputum, so I'm going to clean that out. And then I can reconnect him. I'm just going to lay this down here because I want to have my protective equipment on while I change this over. So I'm going to take this off. And we're going to put his trach collar back on. And we're going to turn it back down to 6 liters. Oh, and what I forgot to tell you at the beginning is what you want to do before you suction your patient is you want to listen to their lung sounds. So if he had that many secretions, he probably wouldn't sound very good. And then you want to listen at the end so that for documentation purposes you can record what you did. Okay, so we're through with that part. This would go in your biohazard bag. So now we are going to move on to his trach care. And trach care, oh, this would go to the lab. So before I took my gloves off, This would be sent down to the lab, labeled appropriately. So for your trach care, you're going to have your trach care kit, and you're going to have a disposable inner cannula. So what I'm going to do is I'm still in the room. We've suctioned him. We know he's pretty clean. So this is what this trach care kit looks like, and a lot of them look differently. The kits we have several different kinds, but each of them have several compartments. I'm going to pour some saline into one of these. Now sometimes you'll get a patient who comes into the hospital with a metal trach or one that isn't disposable, and in that case you would have to clean it sterilely, and that is a bit more difficult than what we're going to do. So we have a disposable trach. We don't have to be as sterile. You want to be as clean as possible. So I'm just going to be using these as my non-sterile gloves. So you're just going to be putting these on. We already have our chucks. We'll just keep using this one. And in this instance, we're going to pretend that a blow-by is okay. So he's got his O2 going. I might need to turn it up to 100%. But we're going to say that he's tolerating this well, just blowing nearby his trach. And we're not going to take too long doing this, so he's okay. So what you want to do is you want to pinch these alligator clips together and pull that inner cannula out. This is disposable, so we would have our biohazard bag. We're going to throw that away. And you're going to take your gauze dressing out. You're going to note the drainage for documentation later. You're going to throw that in your biohazard bag. And then these kits come with a little Q-tips. So if you need to, as you can see the top of this trach, there's a little lip up here. What you don't want to do is go down in the trach. That's the sterile part, but you haven't touched the end of this. So if there's any secretions or crusty stuff up here, this is where you can clean this, but you would never go inside of there. A lot of times they're clean and you don't need to do anything there, but if you do, this is the only time you can get to it, is when that inner cannula is out. So then you're going to take your inner cannula, and the only part that you can touch is this part that is going to end up on the outside. So you take this out. This is the part that is going to be sterile, so nothing can touch this. You're going to put it in there. You're going to pinch those alligator clips together to hold it in there, and now his new trach is in. The rest of it is just cleaning the skin underneath there, so you're going to be assessing for drainage, for skin breakdown, for redness. Anything you need to do, you need to get under there and see what the skin actually looks like. So what we're going to do is we're going to take whatever Q-tips are left in there that we haven't used, and we're going to get underneath there and just clean around there. If there's a lot of drainage, you need to get new gauze is what we can use here. So I'm getting the gauze wet. You're getting underneath there and really cleaning. Might get a different section for each part of that. So I'm thinking that is pretty clean, and then you need to dry it because you don't want, it's already dark, you don't want it to be wet underneath there to have things grow. So you dry it off with a new part of your 4x4. Sometimes it's really hard to get in there. And then you're going to apply your new dressing. And you really want it to go all the way underneath there and meet up at the top, so that if secretions come around that opening down there, that it goes on the dressing and not the skin. So part of your trach care is evaluating the balloon like we talked about. So if this is inflated, then the balloon inside is inflated. In this case it is. If it isn't and it's supposed to be, you need to know if you're able to do that as a nurse, or some places make respiratory therapy do that. This is called a trach tie. So if you ever have to change this, sometimes it gets full of sputum also. But what you want to do is you want to slide this up, put your new trach tie completely around them, have it secure before you take the old one off. Or you need to have somebody in there with you, because if this is untied, even if this balloon is inflated, if they cough, this whole thing can pop out. So when a patient has a trach, there are a lot of safety measures. You want to have an extra trach in the room. You want to keep that obturator at the bedside. Those are things you can learn in your clinical setting, but those are things you need to be careful of when you have a trach. So we're going to pretend his trach tie is okay. We're going to reapply his trach collar. And then documentation would be what you did, what you saw, what the dressing looked like, how much sputum there was, what the drainage in the skin looked like.